It's a growing problem for many men and a sensitive topic, erectile dysfunction, also referred to as impotence. It can occur at any age, but is more common in men who are older. Statistics show about 1 in 4 men under 40 and 15 to 25% over age 65 experience erectile dysfunction. Joining us now to discuss this problem is Dr. Danish Ali with UTMB Galveston. So apparently this is an issue that's more prevalent than we think.
It really is, and it's actually becoming more of a problem as the millennials grow. We have technology at our fingertips now with computers and electronic devices, and because of that, there's more access to pornography. And studies have shown that pornography actually increases your chances of having erectile dysfunction.
So how does that work exactly?
So what it does is it changes some of the receptors that are in the brain, and it shrinks those sexual receptors that we call them, and because of that you're at a higher risk to develop erectile dysfunction.
So if you're looking at porn, and then when you get a real woman there,
right,
or whatever, then
it's different.
It's different.
It really is different.
Okay.
Yeah, and your the brain receptors fire differently, and you don't get as much pleasant activity or joy that you get naturally that you would otherwise.
So we brought some tips here.
That's correct. Yeah, these are some of the risk factors. Aging is one of the most common risk factors. Hormonal imbalances. So folks actually have low testosterone, and that can do it. Psychological issues. So depression, anxiety, relationship, marital problems can cause it. Tobacco, especially alcohol and tobacco, they vasoconstrict arteries, and it makes it difficult to get those erections. Medications such as antidepressants and antihypertensive, specifically beta blockers and diuretics, and then diabetes and thyroid issues. Hypothyroidism can do it. And lastly, the pornography, like we were talking about.
So how can you get help if you're experiencing this? What do you, and first of all, you have to get over the psychological hurdle of telling someone.
That's correct. So that's why it's very important to be honest with your medical provider, discuss these things with them, and they can help kind of diagnose it. There's blood work that can be done, there's imaging studies, there's ultrasounds, there's lots of different tools that we have to diagnose it and then treat it as well. And with small, minimally invasive things such as medications and other things that you can use. There's also prevention tips that we also have. Diet being one of them. The more green stuff that you eat in your foods, it increases nitric oxide. Exercise is very good. Avoiding toxins. So tobacco has so many, over 7,000 toxins in it. So avoiding that. Address relationship issues. So if you're having problems at home, address those. Sleep is very important as well, and pornography. And then lastly, get evaluation from medical providers.
So you can't just take some Cialis and call it a night.
You really cannot. You really should get diagnosed appropriately and treated appropriately.
All right, Dr. Ali, thank you for this serious subject that you brought to the forefront, because people are ashamed to talk about it. Thank you, sir.